times get hard, and we're here to help at NorthPoint.
Hello, welcome to another episode of NorthPoint Making Health Happen. My name is Lisa Castile, your host for the program. Thank you so much for tuning in today. This series is being brought to you by NorthPoint Health and Wellness Center. We want to connect with you about topics in health and wellness that impact our community, and we want to provide you with practical tips and resources you can use. Today, we will be discussing heart health with NorthPoint's Director of Clinical Services, Dr. Rahshana Price-Isuk. Welcome, Dr. Rahshana.
Thank you, Lisa.
We're so glad to have you here.
Thank you.
Yes. So before we get started and we talk a little bit about your background and how you came to be here at NorthPoint, you brought a little friend with you to the program today, to the studio.
Thank you for noticing.
Yes. Now, what is that, Dr. Rahshana?
This is my little friend, the heart.
Heart.
Okay.
Mm-hmm.
And for those listening and not able to see, it's important to know that the heart is actually the size of the palm of your hand.
Okay.
Your heart can fit in the palm of your hand.
Wow.
And for centuries, the heart has been thought to be the center of life and emotion. And now, even in today's modern medicine, where technology is really advanced, we now know that the heart is central to life, and it's where we hold a lot of our emotions as well.
Wonderful. That's beautiful. Well, thank you for bringing your friend.
You're welcome.
Very cute. So now this actually makes me think about something I read. You have wanted to be a doctor since you were 4. Since you were a wee little girl.
Since I was a wee little girl, I had a Fisher-Price set, and I'm an only child, so
Okay.
I would use my parents to check their temperature and their reflexes and give them shots.
Oh my goodness. I
Yes.
can't even imagine those little I remember those Fisher-Price. We are dating ourselves
Yes,
right
we
now
are.
by talking about some
Yes.
Fisher-Price doctor
Absolutely.
sets. Wonderful. And so now you're here at NorthPoint, where you're our Director of Clinical Services. So tell us about your role and what you do.
Sure. So I'm a family physician. I'm a board-certified family physician, and I do still see patients here at NorthPoint part-time, seeing everyone from beginning of life to end of life care. And I also am over integration of our departments at NorthPoint, which include medical, dental, behavioral health, human services. We also have full radiology, meaning we do x-rays, mammograms. We have pharmacy and lab here at NorthPoint.
All right. Wow. You are doing things here at NorthPoint.
We're all busy,
I
yes.
love that. And you are also out in the community and doing things, correct?
Yes, I am. When I get the opportunity, through NorthPoint. So things like today is getting information that's vital to our communities out to the community. I have done collaborations with the University of Minnesota. I recently spoke on cancer prevention over at the UROC Center, trying to get our folks, geared up to prevent and detect cancer at early stages and to
Okay.
get treatment.
Wonderful. Well, let's talk about the heart. Why is this, you told us that the heart is at the center of life, right? So this is obviously a very important topic. Talk a little bit about that. Why should we be focused on our heart and our heart health?
Absolutely. If your heart is not healthy, you don't feel good. Okay, the heart is central to our functionality or our day-to-day functions. So when you talk about something called functional capacity, what is your capacity or what is your ability to do the things that you need to do day to day to day? So, for example, the function of your heart is to pump the blood throughout your body, to nourish all the tissues, etc. Okay? If your heart is not functioning correctly, you might feel tired all the time. You might feel fatigued. You might go up a flight of stairs and feel very short of breath. So you can't function well if your heart is not healthy.
Okay, and so we might be in community and not feeling well and not even knowing that it could be symptomatic of something going on with our hearts, yes?
Correct.
Okay.
That is true.
Okay. So what would you advise to our listeners about heart health, about checks on your heart?
Sure. So let's talk a little bit about, I know we also have had a recent focus on heart health for Black and brown women as well. I know you wanted to talk about that. So when it comes to our heart health, what we have to know is that everything we do impacts our heart. Okay, so managing stress, nutrition, having a physical once a year with the doctor, even doctor, nurse practitioner, healthcare provider, whoever you prefer to see, but seeing that person once a year to talk about your overall health, your heart health, to get certain screenings. And there's actually a basic test you can do called an EKG in an office that can tell us some things about your heart, you know, at a basic level. So doing those things are at the foundation of kind of being set up to prevent heart disease and heart issues. And then one thing about our Black and brown women and communities is sometimes our symptoms are different, or we might communicate them differently than what we're taught in our training or what we're taught in school or what we consider quote unquote typical or mainstream. So it's just very important to talk about what's going on in your body, in your health, with your heart.
And so when you have NorthPoint guests that come in and they start talking about these symptoms, you are trained to listen for cultural. You're trained to be culturally responsive, is where I'm going with this. So you know what those symptoms are, what they may sound like. Correct?
Correct.
Okay.
Correct. So we're trained to listen and we're trained to ask questions. And so I know a lot of times, especially in our communities, there's a lot of mistrust of the healthcare system and people get guarded when we ask a lot of questions. Those questions are designed to help us kind of translate what you're feeling into a medical model so that we can understand what test we might need to do.
Sure.
You know, is it something we can do at the local health center? Is it something we need to send you out to the hospital to get tested? Is it a blood test? Is it, you know, what is it that we need to do to really get to the root of the problem or the symptoms or the concerns? So just encouraging people to really talk and to be open and to be, you know, as honest as possible.
Sure. What about some of our Black and brown populations who've already had a heart episode? What would be some things that they need to be aware of and maybe come in and have rechecked?
Sure. If we can back up a little bit, I'll start with just some of the symptoms that people can have related to the heart. And so when you talk about heart episodes, we could be having a panic attack that feels like a heart attack. We could be having signs of what's called a heart attack. What people are most fearful of is having what the community calls a heart attack, right? And a heart attack is basically lack of oxygen and flow to the heart, okay? And when we talk about carrying even our emotions in the heart, okay, your heart can start racing. So you can be sitting down and feeling like you're running a marathon. Or I'll often ask patients, do you have the sense of what we call palpitations, meaning like I feel like my heart is jumping out of my chest, or I feel like my heart is skipping beats. Those are things that people might tell you. And those could even be signs of stress. It could be signs of something called an arrhythmia, when your heart is not boom, 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 but it's boom, 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 or boom, boom, boom. You know, there's not a regular rhythm, so that's a whole different heart condition. Then when it comes to a heart attack, we can be having a crushing sensation in the middle of our chest or to the left of our chest. That pain, pressure, or crushing sensation can go into our neck, into our arm, into our jaw. And those are the typical signs and symptoms of a heart attack, or what we in healthcare call the textbook, like what we were taught in school.
Sure.
However, in women, and particularly Black and brown women, you can be having a stomach ache and be having a heart problem, like a severe stomach ache. You could be having a backache. Again, you could be feeling severely fatigued. So when it comes to heart health, if there's like a drastic change in how you've been feeling, you really need to talk to someone.
Okay. Take the
about that.
time and make it a priority to get in to see someone. Because I know we get really busy in our lives. And, you know, culturally, I think our culture, we have some dispositions for these types of debilitating diseases. Heart health, high blood pressure, hypertension, those types of things. Can you talk a little bit about that?
Sure. When we talk about, what are the common heart diseases or heart conditions in Black and brown women and other people, high blood pressure is really common in our communities, and people don't necessarily think of it as heart disease, but it is a condition of the heart, a chronic condition of the heart. When you have high blood pressure, your heart is working harder. Okay, so this little heart that I said is the size of the palm of your hand. If you're working the heart too hard, it can become thickened. So I like to tell people the heart is also a muscle, and it's the only muscle in the body you don't want to get beefy. You don't want it to become like those big biceps.
Right.
You want the heart to be a nice size and to stay the size that it is designed to be for your body.
Okay.
Okay.
All right. That's what happens with high blood pressure. So what about hypertension?
Yep. So hypertension is just a medical term for high blood pressure.
Okay.
So they're one
Okay.
and the same,
Same thing.
and that is very important to know. So thank you for bringing that up. So when you have hypertension or high blood pressure, there's a high. I like to describe it as when we used to drink out of the water hose when we were coming up. For those of us who are of that generation, if you squeeze the water hose and make that little hole smaller, the pressure is higher.
Yes.
So that's what's happening in blood vessels to develop high blood pressure. And the risk factors for those blood vessels becoming more narrow are smoking, because it hardens the blood vessels, or what we call arteries. High cholesterol is a risk factor for heart disease and narrowing of those arteries, or what we call cardiovascular disease, sometimes linked to high cholesterol, smoking, and then nutrition leading to high cholesterol. So eating too much animal fat, so, beef, and things that are butter, fried foods.
all that stuff that tastes so good.
All that stuff that
Yeah.
tastes so good. I'm a person of moderation, have a steak once a month or every other month, but, things like that. So, this is such a rich topic. There's so much to cover. So, here at NorthPoint, we even have a hypertension group visit in class. So if you have a primary provider at NorthPoint and you have hypertension, you can be enrolled in one of our classes. So hypertension is one form of heart disease. Then there's things called like congestive heart failure. Okay, that's another heart disease that can impact our communities, and it can be caused by many things like diabetes, high blood pressure. There are actually viruses and infections that can get to the heart and cause inflammation of your heart. And so again, that central heart, anything can happen to your heart. So it's just really important to stay in tune with your body, stay in tune with what your body's telling you, and see a primary care person at least once a year. And if you have high blood pressure or diabetes, you might need to be seen 2 times a year or every 3 months.
And I have both, so I'm definitely, I go and get checked. But it is overwhelming, right? And I can see that you are very passionate about health education Yes.
I am.
Yes.
Yes,
And
indeed.
empowering our communities
Yes.
on these topics, because it can be overwhelming, and all the terms, trying to understand that. So I love that you're saying here at NorthPoint that we offer resources for folks, so they're feeling upheld in this journey, right? They're not just out there by themselves. We have clinicians here that can walk alongside them.
Correct.
Nutritionists,
Correct.
all kinds of folks, yes?
Yes, we
Okay.
have. Yes, like you said, we have doctors, nurse
Yeah.
practitioners. You know, just independent providers that can work with you. Registered dietitians, certified diabetes educators, community health workers. We have many resources
Yeah.
and ways that people can get help. Care coordinators to help navigate the complexities of the health system, helping
Okay.
you get appointments, helping, you know, with whatever we need to help you with to get you here and get you healthy.
Absolutely. I want to go back to talking about, you know, from a behavioral health type of standpoint. You talked about stress, right? And we are definitely an overstressed society. How does that play out with heart health? What are some things that we can be doing, making choices? Simple things.
I know one thing that's being taught is just mindfulness and kind of meditation and deep breathing to even regulate, you know, regulate your heart rate, regulate your breathing by taking a few minutes from your day to just, you know,
Take some deep breaths and
take some deep breaths and
Yes.
kind of settle the mind and even take notice of what your body is feeling like and sensing and those types of things so that, you know, we are in tune with our body.
Sure. What about someone who, because I remember my mom had a open heart surgery, and afterwards she dealt with a lot of emotional things that went on, and I think that's common for heart patients. Yes. So can we talk about that a little bit? What are some ways that we can support someone who has gone through like an open heart surgery or some type of big surgery like that?
Absolutely. That's huge. Like open heart surgery is huge, and just having, like you said, a heart attack or something significant happen to your heart is a big deal, and it impacts your life. You know, most people feel like, oh, I never thought this would happen to me, or I never knew I would be in the situation. And then depending on where you are in your life, not being able to maybe function the way you used to function, so that can cause some, like you said, maybe depression and sadness and things like that. And so, you know, behavioral health providers, so therapists, counselors, social workers to support, you know, surrounding yourself hopefully with family, friends, getting that support. And then again, because I'm passionate about primary care, having a good primary care provider, because there are also many medications that people end up on after having a heart attack or having open heart surgery. And some of those medications can actually cause things like sadness, depression, sexual dysfunction, fatigue. So you need to be talking about, you know, these things with your provider. It's not just because you had a heart attack, or it's not just because you had open heart surgery. Maybe it's the medications. And you know, knowing that and understanding that is helpful, because maybe there's an option to change some medications. Or if there's not an option to change the medication because you need it, maybe there are other things we can do to help offset some of the side effects of those medications.
Sure. And I know people, you know, there's so many things that impact that. Some folks who can't afford to take their medication, or like you said, they're experiencing symptoms that make them feel a certain way, so they don't want to take their medications. And I know here at NorthPoint, we have a very strong pharmacy team, and we have pharmacists that will actually meet with our guests, right?
We do.
And talk to them and consult with them about these things.
Absolutely.
Okay.
We have a great pharmacy team here. We have pharmacists working very hard to get medications out to folks who need them. And then we have clinical pharmacists who are considered, doctors of pharmacy, and they meet with patients individually to talk about side effects, talk about the effectiveness, meaning is the medication working? And if not, those pharmacists communicate with the primary providers to say, hey, would you consider changing this to this medicine? So it's a team effort, and team-based care here is important.
I love that because, so many times you go to your physician and they diagnose you, and then that's just kind of the end. You get your diagnosis, you get some medicine, but here we take a really different approach to our care.
We do.
Right?
We do. It's a team-based approach with hopefully the guest or the patient at the center of the team. So I really want folks to know that you're the team leader here, and getting what you need, getting your questions answered is very important. And it can be tough for our patients because sometimes we do, with the team-based approach, you might need multiple appointments.
Sure.
But, just talking to the primary about what's reasonable for you. And we offer video visits, telehealth visits.
Many options.
Many options.
Okay.
Many options that we can make available when it's appropriate.
Okay. Well, let's talk about lifestyle for a minute because I know there are some things. You mentioned nutrition, but there's also physical activity that you can do to help your heart stay healthy,
Absolutely.
Right? Okay.
So we've talked about 2 sets. We've talked about people that have never had a heart event and then folks who have had a heart event. All of us have a different level of what I called earlier functional capacity, our ability, okay? So when it comes to exercising, you really, especially if you're maybe about 35 or older, you should be talking to your primary provider about what type of exercise you can do or getting that EKG test in the office just to make sure things are looking okay.
Sure.
But starting from where you are. So if you have a job where maybe you're at a desk all day, you don't do any walking, you can start with walking. Okay. If you are a person who, many of my patients will say, oh, but I walk all day at work. Your body has adjusted to that level of activity. So you have to stress the heart in a good way. Okay, your heart rate needs to be elevated. So you do have to exercise the heart. So there's a good, so we talked about this before the show, Lisa, when you asked me if I was nervous. I said, yeah, a little bit. It's always healthy to have a little stress. So there's good stress and there's bad stress.
Okay.
When we talk about exercise, you have to elevate. So start from where you are and work your way up with walking, lifting a little weights, whatever you need to do. And there's resources out there to figure out what your heart rate should be for your age, and the level of exercise you should be doing. And you can talk to a fitness trainer, you can talk to a doctor, but you should be in conversation with someone who has knowledge about activity.
Absolutely. All right, one other thing I want to talk about, because I know that you also enjoy working with young people. And then I think sometimes young people, they think nothing can ever happen to them, right? They're invincible. But we know that family history plays an important part in our health, right?
Absolutely.
So if what would you say to our young audience right now, those who they know that, maybe grandma or mom has high blood pressure or diabetes or something like that, what would your advice to them be?
Please take care of yourself while you're young. Know your family history. Ask mom, dad, auntie, cousin, whoever's available. Some people are not able to obtain their family history for various reasons. But talk, get to know what's there, exercise, eat right. It's just natural brain development that teenagers think they're invincible. So, I have a son who ate healthy, and then he turned 16 and the hot Cheeto diet just set in. I was like, what is this?
All that
It's
sodium.
Yeah. So anyway, just trying to continue to reiterate with the young folk, like to live a healthy lifestyle, stay active, get involved in sports, eat healthy, talk to your family.
You only get one heart.
You only get one heart. You only get one heart.
You gotta
You
take care of it. Yeah, absolutely. Well, we've covered a lot of topics today. Is there anything that you would like to share with our listeners that we maybe haven't talked about?
I would just like to share that primary care and prevention is important before an event, after an event, and always. Even if you're seeing a specialist, like a heart specialist or cardiologist, your primary care is your go-to for prevention, for education, for help in understanding and translating what specialists aren't always talking about. So we're here. We're here to help. We're here to work as a team. And don't be afraid. We're not trying to give you something. We're trying to help you stay healthy.
Yes. And you mentioned before that NorthPoint is a great place for women to come and get resources. Yeah?
Absolutely. Okay. So a community clinic like NorthPoint has many resources. So you can come in and find out what those resources are and how they may be able to help you.
Perfect. All right. Well, thank you so much for being on the show today.
Thank you for having me.
Yes, we've enjoyed our time with you, and thanks for bringing your heart friend. It's great to have a visual like that.
Yes.
Yes, and folks watching our YouTube channel can see for themselves.
Can see for themselves.
Yes.
The heart fits in the palm of your hand.
All right. Wonderful. Thank you for listening to this week's Making Health Happen. We want you to know that we're here to partner with you and to help make health happen in your life. To learn more about NorthPoint, call us at 612-543-2500 or visit us on the web at northpointhealth.org.